Nausea and vomiting are common side effects with many different chemotherapy medications. It is most common with drugs such as cisplatin, carboplatin, oxaliplatin, cyclophosphamide, and doxorubicin. This side effect can be very uncomfortable, but fortunately there are many different ways that it can be managed. Nutrition is one factor that can play a large part in helping to prevent nausea. Instead of eating large meals 2 to 3 times a day, you may find it better to eat smaller meals at more frequent intervals. This can lower the chance of you experiencing nausea, and if you do, it could lower the severity. You want to avoid ever feeling hungry, which is another reason why you may want to opt for the smaller meals multiple times a day. In the mornings, dry foods are best to prevent upsetting your empty stomach. Good examples of breakfast foods would include cereal, granola, or toast. Try to avoid laying down flat for at least 2 hours after eating, as this can often worsen nausea. We all have our favorite meals, but this may be something that you wish to avoid as you go through your treatment. The reason for this is if you experience nausea or vomiting following these meals, you may no longer enjoy them as you once did. One strategy is to watch over your first few cycles to see how your nausea develops. If you find periods when your nausea is not severe, this could be a good time to splurge on your favorite meal. It is also important to maintain proper hydration to lessen the risk of nausea or vomiting. Try to drink at least 8 cups of juice or water each day. It is okay to enjoy a beverage with caffeine, but it is also possible that it could worsen your nausea. You can see how this will affect you. In the event that you are vomiting, try to make sure that you drink extra fluids to replace what you have lost. A good example of drinks to replace this fluid would be a sports drink such as Gatorade or Pedialyte. In addition to these nutrition and hydration recommendations, you may also find that wearing loose, comfortable clothing can help to lessen your nausea, as well as avoiding strong smells. You may also find it beneficial to have something that you enjoy to distract you as you receive your infusion. This can include your favorite music, TV show, or a movie. In any treatment regimen with the potential for nausea, there will always be medication available to help you. This could include pre-medications, which are given prior to infusion to lessen the chance of or severity of nausea and vomiting, as well as needed medications, which can help with any lingering nausea that you experience in the days following your treatment. If you ever feel like your medications are not helping with your nausea, or if you are unable to eat, or if you are vomiting multiple times a day, please reach out to your care team for help with finding other medications that could help you. This has been a review of nausea and vomiting associated with chemotherapy treatment. If you have any questions, please contact your care team.